We are in 6 schools on the north side of Chicago, 4 high schools, 2 elementary schools, and we're adding a 7th school.
We look at the patient as a whole, mentally, physically, and where they're going, what they want to do, and what we can do to help.
We are very proactive in the students' lives. I'm not waiting for a student to be sick to come and see me. If I know they need a physical, I'm going to schedule them for them.
If there's nobody to care for the student goes home if they're not feeling well, which means all those teaching minutes, all that opportunity for learning, that's lost.
The difference between living in State and East Africa is the clinic. Because back there in my school, we didn't have a clinic to help us if we get injured or we want to see a nurse. But here we have that, so that makes such a big change.
We're helping a lot of our refugee and immigrant students get acclimated. We're getting them healthy. We're baseline getting them caught up on their immunizations. We're here for them to talk to us if they're having crisis.
They treated me really good with respect, and they heard me. I do trust them a lot. They also have taught me how to make my own decisions now.
We also see a lot of our students from the neighborhoods that have had some PTSD or trauma experiences.
Our goal is to get these kids healthy and to get them to graduate.
When you think about the SMART model here at Sullivan, you think about cohesiveness with the school. When you think of Sullivan High School, you think of the clinic because we are a part of the culture of the school.
They really build a relationship with you. They make sure you're comfortable, and they're like people you can come and talk to if you ever need to.
My mental illness is bipolar, schizoaffective, ADD. With bipolar, I go up and down. I might think in one of my manic episodes, oh, I can control this, I can do this. And then when I come down, I'm thinking, I'm so glad I did not make that decision.
HHC allows us to get immediate access to health care, including dental health care, psychiatry, medical health care, right off the bat for Thresholds members.
The Justice Program in Thresholds has worked really hard meeting people in jails before they're released to help that transition into the community with services.
I have a psych appointment, then I have a medical appointment, then I gotta meet my worker all in one day, all in one building. That's great.
This is a place where everybody from the front desk staff to the psychiatric providers are all very sensitive to the struggles and the trauma history many of our patients have had.
As far as transitioning into the world, it was a little scary because I felt like I was walking on eggshells because I wanted to do everything right. I wanted to keep taking my medication. I did not want hospitalizations.
Helping people coming out of the nursing homes. There's nothing better when the whole community of Thresholds and Heartland and the member come together and see that member just doing amazingly well with full independence.
I get that peace of mind when I get to go home. I get to sit down and think about my day. What did I do? Did I accomplish anything? Did I give somebody self-esteem? Did I give somebody advice? It's awesome. I mean, coming from where I came from, having nothing, to having little, to being on top of the mountain is like, it's kind of like breathtaking almost, like you gasp, you're like, oh, I made it.
I met Patricia after she had her 3rd child, David, and he was born with a birth defect known as cleft lip and cleft palate. He had to have 3 surgeries, one for his palate, one for his lip, and the one for his ear tubes. She's the one that will look for a specialist. She's the one that will recommend me what to do. And I've been having a lot of struggle with David. So she's the one that always helps me on everything.
Our job was to get him hooked up with services, and that included speech language pathologists, plastic surgeons, and special dental services also. It's taken about, 2 years for him to really, stabilize. Thankfully, we have a good outcome now. I'd like to think that our coordinated efforts is what helped, get us to this point.
Dr. Ahmed is just like another member of my family. I know I could come and bring the kids and also talk about something that I'm going through, and she will listen to me.
Our emphasis is on serving those who are underserved, uninsured, or underinsured. even those who are undocumented. And that is our mission. It's always been our mission. This is what we do.
My husband was detained because he was working under a visa. They were going to deport him. So we contract a lawyer, tried to get him out, and everything was denied.
When her support system was taken away from her, and she was left with these 4 beautiful children, I hope I was a shoulder for her to, at least, if not cry on, unload some of her stress.
While I was going through a lot of stuff, Dr. Ahmed kept on in touch with me. She called me to make sure the kids were doing good and that I was okay too.